Welcome everyone to another Jewish Physicians Network Jewish Medical Ethics session. It's my pleasure to introduce Rabbi Dr. Yossi Cohen. Rabbi Dr. Cohen received his undergraduate degree in biology from Yeshiva University before completing his medical studies at the Technion American Medical School in Haifa, Israel, where he earned an MD. Currently, Rabbi Dr. Cohen is pursuing a PhD at Columbia University right here in New York, because sometimes, evidently, one doctorate is just not enough. For over 5 years, Rabbi Cohen has been a dedicated research assistant for Rabbi Dr. David Blythe, conducting research on contemporary issues in medical ethics and halacha. He's received his rabbinical ordination from YU's Rabbi Isaac Elchanan Theological Seminary, REITS, back in 2019. I'm not sure if I got the order correct in all these accolades, but I do know that Rabbi Cohen has many hours of audio on such esteemed platforms such as YU Torah and, of course, the JPN podcast. So without further ado, thank you, Rabbi Cohen.
Thanks for the introduction. Where'd you find that information? Yeah, so the inspiration for this talk is actually based on a very similar talk from the opposite perspective that I gave to YU Smicha guys, and that was specifically focusing on how to paskin medical halacha questions. From the rabbi, they should be aware of what they be thinking of when they're trying to think about medical questions, how it affects their congregants and the people that they're responsible for. So decided to flip it for this talk, and that is specifically focus on our perspective as physicians. What our role in this relationship is, in this triad of the rabbi, the patient, and the physician. So just a couple of different things we could be thinking about, right? So for example, the classic cases that, the most classic medical halacha, issues with real serious consequences. One is obviously a patient that wants to abort a fetus. She finds out we'll make it easier. She finds out there's some sort of congenital abnormality, and she wants to abort her fetus. She wants to terminate the pregnancy. Or another example, classic, a patient's on life support. They had enough. They want to end. They want to remove themselves off life support. So the question, obviously, depending on which community you serve, who's your clientele, is both true for the rabbis and the doctors. The questions that you're going to get are going to be a little bit different. As you know, some communities, they ask their rabbi everything. Some communities, they couldn't care less what the rabbi has to say. They're focusing more on the doctor. And then probably most Orthodox religious Jews have some sort of are somewhere in the middle, where they're certain questions, maybe they're not involving a rabbi. Other questions, they are involving a rabbi and a physician. So the question is, who's the one that's actually supposed to answer this question? So I propose two models. One model is the physician presents facts to the rabbi, and then the rabbi makes a decision. The rabbi sits in his chair, patient goes over to him or puts the physician in contact with the rabbi, and then the rabbi makes a decision about what exactly they should do. And then potentially a different model is the exact opposite, the reverse. The rabbi presents the halacha to the doctor. He tells the doctor, listen, here are the things that we are concerned about. And then the doctor makes a decision of how they should proceed. So there is a problem with this model, and the model obviously is either model is we keep everything in isolation. The doctor does what he does in his room, or the rabbi is doing what he does in his room, and maybe there's a little bit of interaction here or there. But bottom line is we're going to end up with a problem, and that is it manifests itself very clearly in certain chuvas. Now, certain responsa that were written. Now you have to want to be a little bit careful, and that's actually why most of my examples are going to be from Moshe Feinstein, because then hopefully nobody will think that I am being mezalzel with Talmidei Chachamim. That Moshe Feinstein is obviously probably one of the most important, and one of the most important poskim of the last generation. And as such, when I point out certain issues with some of his responsa, hopefully no one's going to have get the impression that we are chas v'shalom being mezalzel in Talmidei Chachamim. I feel the need to do this to highlight this issue. So let's have some examples of outdated information. Again, as I point out in this slide, there's two different potential issues. One issue is that the information that the rabbi has is just outdated. Maybe they wrote something maybe Moshe Feinstein, for example, wrote something 50 years ago, 60 years ago, it's no longer necessarily the case. But yet, some modern day rabbi who doesn't know any better, his exposure to these sort of questions was by reading tshuvas, was reading these responsa. So he gets his medical information from Moshe's tshuva. And then you run the risk of outdated information. The other issue, and I think potentially just as equally problematic, but also potentially also a little bit more problematic because this could also result in issues in contemporary times as well, and that is just the rabbis receiving inaccurate information, and therefore is making a decision based on facts that are not actually the case. So let's give some examples just to highlight this point that this really does exist, and I'm not just making this up. So let's talk about IUDs. I have a tshuva for Moshe Feinstein. Who's our audience? But everyone is aware of basic. I'll explain everything just in case. So an IUD, in case anyone's early on in the medical training, intrauterine device. Right, so it's this looks like a cross you put inside the uterus, and there are two types. There's a copper IUD, there's hormonal IUD. Also, I'm not an OBGYN, so hopefully my information that I'm presenting here is also accurate. But there's two types, basically. There's a copper IUD and a hormonal IUD. Basically, they both prevent implantation of the fetus. Hormonal IUD is particularly advantageous because it also regulates the cycle. People that after, I think, approximately 6 weeks or so is the general time, but after approximately 6 weeks or so, women usually stop having their period. So if you want to avoid neither questions, a hormonal IUD is very convenient. Copper IUD can potentially cause more issues because a copper IUD causes a lot of breakthrough bleeding, actually there's less breakthrough bleeding with copper IUDs, but the actual periods are much heavier, so it's harder to get out of becoming a nida. Sometimes the period lasts a little bit longer. So those are the two things you want. Those are the two different types of IUDs. However, if you read a tshuva for Moshe Feinstein, you'll see he's talking about different types of birth control for this woman, and he says, this doctor apparently had recommended that you use some sort of hetken toch uchmi is a device, intrauterine device, in other words, an IUD. Right, it's very hard to become tahar after using an IUD. And again, the problem with this tshuva is if I'm using it nowadays, that means I am not aware of the fact. I'm just looking at this on Moshe, and congregant comes over to me and asked me what sort of, we agree that she should be on some sort of birth control, and now she asked me what type of birth control she should be on. I read this from Moshe, and I said, well, definitely don't go on an IUD. If you use an IUD, then you're going to run into all these issues. Moshe says it clearly in his tshuva. You should know I actually had a very similar situation a little while back, where my only medical knowledge had been this tshuva, this woman who had a lot of breakthrough bleeding on the birth control method that she was currently using, constantly had a nida issue, and was constantly becoming a nida. And very simple solution to her problem was just simply switching to an IUD. If I would have just read this on Moshe, I would not have known that this was an option. Wouldn't have known to recommend that she speak to her physician about this option. And this one would have continued being stuck. But being able to switch, she got out of the issue. Another one for prenatal screening, which is very a hot topic, at least in certain circles, and that is what Moshe says you shouldn't do any sort of prenatal screening. Why? You can't trust doctors. It's not even worth it. And he says, sorry, this is not in this excerpt, but earlier on in this same tshuva, he says, why should I do any sort of prenatal screening? If I do a prenatal screening, what's the question? Why am I using this modality? Because I want to know whether or not to abort the fetus. And so you shouldn't do any sort of prenatal screening because Moshe, as I'm sure we all know, thinks only in very, very rare circumstances are you actually allowed to abort. So there's no real reason to do any sort of prenatal scan. Problem is that even if you don't think that you should abort, there's still a reason, and you wouldn't abort irrespective of what the ultrasound tells you. or any of the other prenatal screening tests tell you, there's still a reason to do them. One, very simply because in rare circumstances, there are certain defects that we could fix in utero. So you would be able to fix those. And the other one is because if it's a high-risk birth, then you want to know to give birth in a hospital where there's a NICU nearby and where they're standing ready, preparing to receive this baby that's going to have all these issues, going to need immediate support. So using, for example, this Moshe, again, might have been true when he originally wrote this, but using it nowadays is going to be problematic. I've heard people quote this of Moshe as an argument for not doing any sort of prenatal screening, and I know people that follow this. The other type, that was outdated information. The other type of issue that we can discuss is inaccurate information. Again, I'm going to use Rav Moshe. So Moshe is a question here whether or not this woman can, again, use some sort of birth control, because apparently she and her husband are carriers for Tay-Sachs. I don't think he specifically says Tay-Sachs, but it's very clear that's a disease he's referring to here. He says this baby is going to be very sick. This baby is only going to be able to live for about 2 years. They're going to be very, very sick. Anyways, this is clearly true about Tay-Sachs. And he says, really, you shouldn't use any of these options. He doesn't like a lot of the different suggestions that he brings up in his tshuva, and he concludes, it's very hard to read this, but basically he says over here, just tell the woman, just wait a couple of years, she'll get healthier, and then she'll be able to have a baby without any problem. Now, obviously, we all know how autosomal recessive diseases work, but it has absolutely nothing to do with the health status of either the mother or the father. Genetic disease will affect you irrespective of how healthy you are. And so there's still going to be the same issue over here with this tshuva is, again, if I'm using this tshuva to paskin like a temporary medical halachic issue, we're going to have a problem, because again, I'm looking at information which it was wrong when it was written, and Moshe did not get accurate information when he was writing this response. Also, everybody feel free to interrupt at any point. I'm more than happy to get interrupted and to address anything as we go. This one's not a Moshe tshuva, but this was actually during someone put out this pamphlet before COVID. There were apparently other outbreaks here and there. And this one was right the summer before COVID. I don't know if anyone remembers, but there was a measles outbreak. And there was this journal, Oh Yisrael, it's a journal from Muncie, I think. And they had a whole bunch, they had a special issue dedicated to discussing vaccines. Anyway, they quote over here, at least one person said you shouldn't get vaccinated. And on the list of reasons why he said you shouldn't get vaccinated is because the chances of getting any sort of disease from, for example, contracting measles is incredibly slim. He quotes, Echad me'elef, it's 1 in 1,000 chance of even getting sick from this. So there's no real reason to put yourself in this so-called dangerous situation of getting vaccinated. I would just point out, and that's why I included this picture over here, that he is correct. When you have herd immunity, the chances of getting measles, of contracting measles, is quite small. However, when you live in any area where a bunch of religious Jews live, where we're all living on top of each other, we're all very close to one another, first of all. And second of all, there's more than one person who's not getting vaccinated. And then you run the risk of contracting the disease. The risk is much higher. Vaccines is a thing all over. So forget measles. This was also an issue in Israel. This happened a couple of years before. So in Israel, they get children get their vaccines in school instead of having to go to the pediatrician. They just vaccinate all the kids in school. Much easier, much more efficient. So apparently in religious schools, this is the Tilomi Rabbanim, equivalent, I guess, modern Orthodox, for lack of a better term. And they wanted, as part of the cycle for vaccines, they wanted to also give kids HPV vaccines. Again, I'm not sure everyone's medical background, but you give HPV vaccines. It's to prevent cervical cancer because, again, it's usually going to occur. HPV is a virus that will usually occur in people that are sexually active. And so we get this vaccine to prevent cervical cancer. So they wrote this whole tshuva about how you shouldn't include this vaccine. Because we don't want to promote sexual behavior in religious teens that have not yet been married. So on the list of potential issues with this, other than it, I think being a little bit sadistic, because that means someone who's not necessarily, I don't know what the percentages are, but I assume you always suspect that there's going to be a certain number of people that are not going to be religious, and those people are the ones that are potentially going to engage, or even the ones that are religious are going to, or otherwise religious, I should say, are going to engage in non-halachic sexual behavior. That means that we're potentially sort of condemning them to get this virus and potentially develop this cancer. It's a little bit of a potentially interesting approach. I mean, the other issue is also there's ways of contracting the HPV virus even without not non-sexually, and in addition, there's also people that get married to people that maybe weren't from at one point and then became from later about tshuva. So there's no reason why we're necessarily putting them in danger. They should also be in a. We would also want to keep them we also want to keep them safe. This was also interesting for some reason, and then appeared in Hamodia, and one of these editors published this as well. I apologize for all the vaccine material, but obviously vaccines frequently become a hot topic. But again, he makes a very similar argument. We don't really have to discuss this too much. So then, I think the question you really want to ask of Rabbanim that are answering these questions, very often people trust, again, especially depends on certain circles, people might trust the Rabbanim more than they're trusting their physicians. So what is it that we want to expect of these Rabbanim? Are we expecting them to answer the questions as they are presented to them? Or do they have the responsibility to determine the facts before answering the question? So I want to point out two different approaches here with Rabbanim that got different questions. So this is the swine flu. There was someone apparently asked Rav Avinel, should you get a swine flu vaccine? And he said his response is, don't ask Enzashul al Rabbanim. It's not a question for rabbis. Why you leave me out of this? We're not doctors. Go ask your doctor. If the doctor tells you it's a good idea, go for it. I'm not exactly sure. I'm not going to hold Rav Avinel responsible to the logical conclusion of that. But potentially what that would argue, if I would take that argument to an extreme, would be that if I have a question, end of life question, if I have a question about abortion, then I should not ask my rabbi at all. I would just ask the doctor. I assume that's not what he means. He means, obviously, he's limiting his argument to situations where there is no halachic perspective. And so from a rabbinic analysis is, what do we know? What do we care? Let's ask the doctors. The physicians are the ones that should be able to answer this question. However, just based off, again, what he wrote, the logical conclusion would be that you always have to ask doctors and not the rabbis. And the other question is, this happened actually, I think like a couple years ago, my sister was in 8th grade in my elementary school, and the Rebbe walks in, asks all the girls whose father is a doctor. So my sister raises her hand, and he goes, you should just know that during the week you can ask your father medical questions, but on Shabbos you cannot ask your father a question. You only are allowed to ask a rabbi. Rabbis are the ones that decide medical questions on Shabbos. So I guess credit goes to the fact that he didn't say you have to ask the rabbi medical questions during the week as well. He at least let you ask a doctor then. But that argument is quite fascinating. The end of the story is, she goes, well, how about my brother? My brother's a rabbi doctor. Can I ask him? His response was, there's no such thing. No way there's such a thing as a rabbi and a doctor. Now this is entertaining and somewhat interesting, but there's real world consequences of these positions. I had when I was doing a ICU rotation in 4th year. It was a COVID ICU. There was a woman presented. She was a Haredi woman, about 35. She was about 35 weeks pregnant. She contracted COVID. She was at home. She was on oxygen at home. Finally, she just couldn't breathe. They had to bring her in. They didn't have a choice. Apparently, her rabbi had told her not to get vaccinated. When he showed up to the hospital, they wanted to do a C-section. We wanted to do a C-section, and then, or at the very least, intubate her. And apparently, they asked the Rav. The Rav told them, "You're not allowed to have a C-section, and you're also not allowed to. You're not allowed to get intubated." Again, eventually, thankfully, that story turned out okay. Eventually, they gave up and just listened to what the physicians were advising them to do. But again, you end up in potential very real-world dangerous situations where people are not answering questions based on good medical knowledge. So I want to also, again, highlight this point of the fact that there is certain responsibility for the Rav over here to have medical knowledge. The Rambam says this, is highest standards for Sanhedrin, but the only people that can go on Sanhedrin are people that know a lot of things. And he says, Yodim ksat misha chachmot, they know a little bit of other wisdoms. For example, his first one on the list is lefot. They also need to know a little bit of medicine. And you'll see a lot of other mifalshim add this to the mix as well. Which brings me to my point, which I alluded to in the beginning of this whole presentation, and that is there has to be, the ideal way to do this is that there has to be some sort of conversation. Ideally, the physician has a basic understanding of halacha, and the rabbi has a basic understanding of medicine. Now, I will point out that it doesn't necessarily mean you only speak to physicians that have a basic understanding of halacha, or maybe rabbis, you should only speak to those that have a basic understanding of medicine, but it has to be both of them working together. It has to be a team effort. It can't just be one working in isolation without input from the other one. As Rav Willig in a recorded shir, he argues that our Bezdin, in other words, the YU Bezdin, the Bezdin of America is the best in America, is not because we have the biggest Talmidei Chachamim, but because we get the facts right. Again, argument being that you have to make sure that you are getting accurate information, which then leads us to the point of the physician's perspective. And that is, as physicians, then we have a certain responsibility. As physicians, we are the ones that have to make sure that the Rabbanim are getting accurate information. That means not only do we only answer questions that we actually know the answer to, because again, remember, the rabbis don't realize, Rabbanim don't realize necessarily how much information you know about certain things, or we don't know about other things. They assume, again, and it's true, most of us will have much more knowledge, much more medical knowledge than anything that they would know. However, if this is not our area of expertise, we have to be careful about which questions we answer, which ones we don't. We have to be aware, or at least self-aware enough to say, like, listen, it's true, yes, as a physician, I do know more information than you, the rabbi, but let me recommend that you speak to somebody else who this is actually their area of expertise. And we also have to be aware that not always is the medical information necessarily relevant. For example, although I think most mohalim will just do whatever the pediatrician says, but in theory, a yellow baby, right, jaundice baby that is, does not get milah, doesn't get circumcised. It's a Gemara. We know that we don't circumcise babies with jaundice. However, we know that physiological jaundice, as physicians, is not a medical reason to not get milah. The kid can have a milah without a problem. There's no reason why we can't circumcise him. However, regardless, that's irrelevant halachically. There's a Masorah that we don't circumcise babies that are yellow, and so even though medically they're totally fine, but that's irrelevant to the fact that we're still not going to do the milah, which means basically we're going to be dochen aseh. We're going to say you're not doing this mitzvah aseh of milah, and that's totally fine. Also have to be aware, which is very important, is the difference in statistics in halacha and medicine. I mentioned before, echad be'elef, 1 in 1,000. In halacha, when you talk about statistics, there's really, I think, only 3 at least that I thought of that I put in this presentation. Right, one of them is a rov. Right, you need most, so rov is 51%. That's good enough. That's good enough for me to be able to assume something halachically. Or if you're thinking about basar b'chalav, then you talk about batal b'shishim, right? 1 in 60th. If there's only a drop in milk with a ratio of 1 to 60 that fall in your soup, in other words, 1.7%, that's enough to say, don't worry about it. This isn't an issue. It's not something I'm worried about. Or if you want to talk about chametz b'pesach, then we talk about echad be'elef, right? 1 in 1,000, 0.1%. These things aren't something that's going to that this is how we think about things halachically. However, if you want to put those in practical terms, let's say there are 300 babies born in Shaarei Tzedek Hospital every week. Those numbers, if you're telling me that we're going to use halachic statistics to figure out to determine medical decisions, if we use a rov analysis, let's say we say that I don't know, whatever procedure most babies die from it, halachic rov, we need 51%. That means that out of the 300 babies that are born in Shaarei Tzedek, 153 will die per week. Or if make it better, talk about batal b'shishim, right? 1 in 60, it's fine. So that's 5.1 babies are going to die every week in this hospital. Or at best, 0.3 deaths per week. So whatever it is, you have to, every 3 weeks, you'd have another death, every 3 weeks or so. You'd have another death. These numbers are obviously not acceptable medically, but they are halachically acceptable numbers. So you have to realize if a rabbi is asking you questions like, well, what are the most likely things that something's going to happen? They have to potentially explain to them the difference between when he's thinking about most in a halachic context might not be the same thing as what we're considering from a medical aspect. So this is a slide I actually showed the smicha students, and that was just again emphasizing the point that we said before, and that is you have to be aware of the fact, and you should make your rabbanim as the doctor in your shul, or if you're in a shul with more than one doctor, great. But if you're the only doctor in the shul and the rabbi is going over to you to ask you all of his medical halachic questions and ask you for your input, you have to make sure that the rabbi is familiar with these concepts. One is that physicians specialize. Just because I know things does not necessarily mean I'm the right person to ask this question to. And also, obviously, just because I'm the one that's currently available to you, that doesn't necessarily mean that I'm the one that can currently answer this question. And as always, it's always a good idea to recommend that people ask for second opinions, because at least with more complicated things, you can also inform the Rav where something is quite straightforward, where this is just basic stuff. There's really no need for this. It doesn't have to become any more complicated, versus things that are much more complicated, and therefore you would have to ask for a second opinion. And I even have, since we picked Moshe from the beginning, we should pick Moshe in the end. Over here he says, Moshe specifically goes out of your way, and this is something that we should highlight as well when the rabbi wants to come over to us as the religious physician nearby. It's not necessarily about asking the religious physician, it's asking the most qualified physician. Here he quotes that you should, one is Shomer Torah, but he's not, I don't know what he's not such an expert in, maybe he's not an expert in whatever this question is, and the other one is a kofar, he doesn't keep Torah mitzvahs. But so what? Rav Moshe says clearly you should ask the physician that has the accurate knowledge that will be able to help answer this question. I just want to give a couple of highlights for this. One is if during COVID there was a question of splitting ventilators. Apparently, I don't think it ever actually happened, but there was a fear that there wouldn't be enough ventilators. So Rav Schachter was asked about this, and Rav Schachter responded in his first response to this question. He had asked a physician that would not have necessarily been as familiar with how this procedure actually works. And you can see that in the tshuva itself. Part of what he describes here is that his assumptions in this response is that a chola is going to show up. You're going to put him on a ventilator, and then a second chola is going to show up later. Another sick person is going to come, also need to be put on a ventilator. So then the question is, can I take the first person off the first ventilator? Can I take the first person off an ideal situation where he has his own ventilator and put him in a less ideal situation where he has to split a ventilator between two people? So that's how he analyzes the question in the first response. In the second one, after speaking to a specialist, I happen to know who this specialist was, but after speaking to the specialist, you notice a significant difference in the response, because here he realizes the question is actually a totally different question. This is not a question of I am taking one patient off his ideal situation and another patient which had absolutely no ventilator, and then I want them to share. This is a situation, the only way you could split ventilators is if I have two patients, each on their own ventilator. I know that they require the same parameters, the same settings for both ventilators. So then I could potentially argue that I can split them onto one ventilator. But I wouldn't be able to make that case unless both of them originally had their own ventilator. Each of them had an ideal situation. The facts could fundamentally change the way you respond to this question. And that's also just a response here from Reb Leif on someone had apparently, after the Hamodia article that I showed you a little while back, someone had emailed him and asked should they get the HPV vaccine for their kids. And here you'll notice that he quotes medical journals. He describes he's quoting current articles, and he's illustrating the fact that yes, there is a reason to get the HPV vaccine, irrespective of hopefully the kids not being sexually active. So here I want to conclude after all that, and that is that highlight these points. One is medical halacha questions can be incredibly complex. And to ensure that accurate information is obtained, we have to make sure that there is a dialogue between the physicians and the rabbanim. Ideally, both are going to have at least some sort of background information in each other's respective field. and that we as physicians have the responsibility to ensure that we provide Rabbanim with accurate information, and to freely respond, I have no idea, when appropriate, when it's not something that is a question that we would be familiar with.
Rabbi Cohen, thank you so much for your time. Yeah.
All right, thank you for the opportunity. Hopefully this is useful and helpful.